rugby players, they don't really wear a helmet that we're familiar. Like an American football player's a helmet and a face mask. You look at it and you think this is really protective of for the athlete to help prevent injuries. Rugby players don't really wear something that's similar to that. So the suspicion here is that there are commonly other injuries to the face and the head in rugby players. I'm wondering if you can discuss those injuries.
Yeah, a broken nose is a pretty common rugby injury. You can also get a torn-up ear. You can get what's called a cauliflower ear. Wrestlers get these too. That's when you tear the cartilage in the ear and there's bleeding in between the layers of cartilage, and it ends up looking like your ear's made out of pancake after a while. Mm-hmm. So rugby players get those who don't wear scrum helmets. You can get orbital blowout fractures, which are not so common but possible. You can get a bunch of lacerations to the face and the scalp. You can get corneal abrasions. Those are some of the injuries you can get.
For those in the audience who aren't familiar with what's available for rugby players to wear on their head, can you tell us what if a rugby player were to wear something on their head, what is it like?
Yeah, people do one of two things. They either wear something called a scrum cap, which is a very light padding helmet. It maybe has a little bit of a silicone gel in there, maybe has some air cells, but it won't prevent you from getting knocked out. What it really does is prevent your ears from getting ripped off. Mm-hmm. You're always sort of, people do that sometimes in the pile-ups, and you also, if you don't have anything to protect your ears, if you're smashing into people, that can really put a rip on your ear. So it protects your ears a little bit. Another thing that people do is they'll tape their ears. They'll take some pre-wrap, wrap it on their ears like a bandana, and then wrap it down with tape, or electrical tape. But it's just going to protect. It's going to maybe at most prevent you from getting a facial laceration or a scalp laceration, but not really even that either. Just good for the ears.